Hello, good day. Dr. Mandell here with you. Hope everyone is having a beautiful day or night, regardless of where you are. Today I want to talk about the most effective strategies, exercises, and treatments that we can do for trigger finger. Now, this is a major epidemic. Now, realize how much we use our fingers every day, from grasping to eating to driving to writing to picking up things. It's a constant battle. We are broadcasting live, streaming live worldwide as notifications are going out to our chatters there. So let's go right into our program here. I think you'll enjoy this. I want to try to be as precise as I can with this because I really want to help people out there in this particular situation, particularly that you follow these strategies, most of these things are going to go away. This is a major epidemic, more commonly in females, also seen in people who have gout, arthritis, particularly rheumatoid arthritis, and diabetes. We find more people who have trigger fingers. Now, trigger finger basically is a snapping. We go to close our hand, we get this pop snapping, usually in the proximal area right here in the joint. Obviously here, this is the area, the proximal phalangeal joint. This is the phalangeal carpal phalangeal joint right here. But what happens is right in this area is generally we develop scar tissue. It's kind of like a ball. We can feel the scar tissue, the adhesions that form in that area, which I'll explain in just a second. And then when we close our finger, this works on a pulley because the tendon is inside of a sheath. And between the tendon and the sheath, we get scar tissue or adhesions, and it sticks. And when it sticks, it closes the finger. So we have to many times do this, pop. And eventually we start getting pain into the area here. Obviously, depending upon what finger it is, that would be the tendon below the finger, here or here or here. But most commonly, these three fingers. We don't see it as common in the thumb. But if you look at this picture right here, we're looking at a snapping sensation, a finger that sticks. Let's move over here so I can give you a little better understanding. We're looking at a nodule that forms right on the other side, on the plantar aspect, on this side of the hand, opposite and the knuckle. And usually if we go ahead and we work this, which I'm going to show you something really cool, and we can relieve this adhesion and scar tissue, we free it up again. But I'm going to go over a few important things with you. Let's look at this picture here. This is just getting another understanding. The purpose of tendons is they attach muscle into bone, okay, because tendons pull muscles. This is what allows me to move my muscles contracting, pulling on the tendon, moving my bone, okay? As a voluntary or an involuntary action is being made from the brain. But when this tendon starts to glide inside that sheath, and now we have an adhesion in there and it can't glide like it used to, it becomes painful after a period of time and people get very panicky. And I could understand why, because it could be very irritating. Here's another picture. You can look at the tendon nodule inside the sheath over the tendon, trying to glide like a pulley. And so we bend this finger. This is actually the fourth finger here. This gets stuck and we have to kind of do this all the time. So that kind of gives you a good understanding of what is happening. Now, people who have these problems, obviously people do repetitive gripping. As we talked about certain health problems, more commonly in females. People who just use their hands all day, pretty much everyone. I mean, from sewing to writing to typing to texting. When do we not use our hands? Eating, making food, just brushing our teeth, cleaning the dishes. I mean, everything we do, we have to use our fingers. We sometimes take it for granted, but please don't, because these are worth lots of important monies of health. So a couple of things I want to go over with you is that there are different philosophies in the past that many orthopedic surgeons, as well as hand specialists, they like to splint. In other words, if you have a problem here, the first thing we want to do, or they want to do, is they want to get rid of the inflammations. So they recommend many times NSAIDs, non-steroidal anti-inflammatories like Motrin or Advil or naproxen to help reduce the inflammation and swelling. Now, you can use ice, will help reduce swelling and inflammation. But I have a little different strategy, and my big strategy is to try to get rid of the cause. If you don't get rid of the cause, obviously it's always going to be there. So I'm going to show you something towards the end. I'll save the best for last. But let's go into a couple of different things I wanted to review with you. And these are some important exercises. Everyone who has a trigger finger, there's about 6 or 7 exercises I want to show you that you should be doing. Just by doing these exercises can really help accelerate the healing process, because most people don't do the exercises, but they work. The first thing I want you to do is, if your hand is on a table, and I'm not on a table here, just to show you through the cam here, I like you just to lift each finger one at a time and just do that for a couple minutes, the best you can, one at a time. And what that's doing is it's allowing the whole network of your tendons to work hand in hand together. And for some reason, this little thing, I can't figure it out, but that little thing that I just told you about can really do wonders for that tenosynovitis, they call this, which is that tendon trying to get through that synovial sheath where it's sticking. So just one at a time, this one, then this one. That's the first one. The second one I want you to do is to take a rubber band, preferably a thicker rubber band than this. And if you don't have a thick rubber band, use 2 rubber bands and just put it around your thumb. And I just want you just to open it, just like that. Go back down. Open it. Good. Now you're working the intrinsic muscles of the fingers. And by doing this, you're working different parts and different muscles. Remember, you've got muscles in your hands. And you need to really work and strengthen those hands, because you just may have a specific weakness or deficiency that can be putting more stress on a particular joint that could be leading to that excess of scar tissue. Remember, wear and tear. If you do something too much, the body puts in scar tissue. So what this does, this actually strengthens the entire intrinsic and extrinsic muscles of the hand. And you want to keep it balanced, because imbalance will eventually cause a problem somewhere in the body. The next one I want you to do is take the finger that the trigger finger is in, and I just want you to make a O with the thumb. So if this is my trigger finger like this, and do the best you can, just kind of hold it, squeeze it together for 5 seconds, relax it. Hold it, 5 seconds, relax it. And do, all these exercises, do about 10 or 12 repetitions, okay, and relax it. Okay, squeeze it, because you're working the muscles in there. You need to really work and exercise those muscles. The next thing I want you to do, I want you to use a tennis ball. I don't have a tennis ball in front of me, so there's a picture. Just take it and squeeze it. Relax it. Hold it 5 seconds and then relax it. 5 seconds, relax it. And do about a dozen, 12, 15 of those. And you'll really feel the muscles all the way down the fingers, all the way down the hand. Because did you know that I can just push on the tendons and the muscles in my wrist, and watch what happens when I push on it. Try it. You're going to like this, huh? Go ahead and squeeze it. Squeeze the muscles in the front of the forearm here, or this whole forearm right here, and squeeze it hard. And relax your fingers. Watch what happens. It makes your fingers bend. So it shows you the levers that go from here all the way through the fingers. Quite astonishing. Next thing I want you to do, just take your hand, just with nothing in it, and just squeeze and open. Squeeze. Hold it about 4 or 5 seconds and squeeze. Open. Squeeze. 3 to 5 seconds. And you'll do about 12 to 15 of those. It sounds elementary, but do it, okay? Because it's really going to help you. Now, if you don't even if your finger gets stuck, don't worry about it. Just do your best. Just keep using the other hands. We want to use the other hands. And I think that would be well. Hello, Star. I want to say hello. I have my daughter in the chat room. The next thing I wanted to show you is we're going to do a 3-point squeeze. Okay. So this one, what we're going to do is we're going to go ahead and take the fingers, go to the base of the hand like this. Open. Go to the middle of the hand. Hold it. 2 or 3 seconds. Open. And go to the lower part of the hand. Okay, good. So it's actually going to be like this. Okay, open. Okay, you're going to the distal area, open, go to the middle area, open, and go to the lower area. And you'll do about 12, 15 of those. That's a great exercise, by the way. Sounds elementary, but it will help you. Okay, the last one if this is your trigger finger, what I'm going to have you do is you're going to take your thumb and your index finger of the other hand and take the finger next to it. Okay, so let's say this is my trigger finger right here. We'll keep it bent just so you know where I'm at. Let's take the thumb and index finger of the other hand and spread it apart like a V, right? Then relax it, okay? Spread it apart like a V. See if I can come in here to show you what it looks like, okay? So let's say this is trigger right here. I'm gonna take these two fingers, the other hand, come in between it and spread it like a V. Spread it, okay? I'm gonna hold it up just so you see. And relax it. Take these two fingers right here and spread it. See, it's a little funky for me because I don't have a problem here. I just want to show you. And you spread it. Just hold it. You're stretching those adductors, the muscles inside, the intrinsic part, the muscles that you really want to stretch. Now, here is a great one. All right, before I show you the grand finale, here's a great one. Okay, here's my trigger finger. Let's use this finger right now. What we want to do, remember, the nodule is right here, and what we want to do is we want to elongate that scar tissue. And I'm going to show you a great way of doing it right after this, but this is the second best way. What we're going to do is we're going to take our other finger just like this, and we're just going to pull it hard. And what we want to do is we want to stretch. See what I'm doing here? Here's my nodule there, and we want to take it and we want to stretch it back, pull it out and stretch it back, pull it out and stretch it back, because you want to stretch that tendon to elongate that scar tissue. Okay? Remember, we're taking scar tissue. Now, here's a myofascial releaser. You're going to say, what is this? Well, we use this in practice for different areas, for knees, for shoulders, for backs, but it is amazing for trigger finger. I had a cardiologist, buddy of mine, just recently. I went to his house. We're good friends. I got rid of his trigger finger in 2 visits. 2 visits. He had it for about 5 months. So you're anxious to see this. The first thing you want to do, let's say here's my trigger finger, here's the nodule. What we do with this device, now you can use anything similar, all right? This is not real sharp. It looks sharp, but it's not real sharp. It's kind of dull on the edges, okay? So what I'll do is I'll take a little lotion, a little emollient lotion here or something like a lubricant or Vaseline, and I'll come in there, that area like this, right? And I just light, not hard, just light. Okay, this is a heavy tool, and we just kind of strip it just like this, and you'll feel it. Okay, and I'll do that for about 30 seconds, and I'll come to a different angle, and I'll hit a different angle of that area like this. Now you notice I'm on a 45-degree angle. I'm not like this. Okay, I'm not like this. I'm on 45-degree angle, and I'm just kind of just lightly, just stimulating and releasing the scar tissue, just like this. This is what we do. It's called myofascial release. Now remember, this is not a big muscle. This is a small little nodule. So I don't want you to be rough on it. I want you to be very, very gentle, but just enough pressure in there just to strip it, just like that, right on that nodule. And then what's good, you can ice it if it hurts you too much, but I like to put like a moist heating pad on there. And what that does after you break it down, it brings in a lot of blood supply. And it loosens it and it softens it. Now, I don't know if you people, if you ever had like corns on your feet or calluses, what do they say the best thing to do for that? Soak it in warm water, Epsom salt. The warmth really softens everything. Well, what we want to do to the scar tissue is we want to soften it. We want the body to come in and start to repair and heal. So as we break this down little by little, and I would do this about every couple of days, once we do it, we want to let it heal and be patient. Because if you had this problem for 6 months, a year, 2 years, that scar tissue has to slowly break down. Another thing I want to bring out to you, it just hit me just now, serrapeptase. Serrapeptase, check out serrapeptase. By the way, I'll attach it to my video below so you can look at my video on serrapeptase. And serrapeptase, here it is. Here's best. This is a proteolytic enzyme. There are many different ones. You don't have to get this. I use 120,000 SPU on me, but they have 40,000, 60,000, 80,000. You may want to start out a little lighter. But serrapeptase, what it is in a nutshell, is proteolytic enzyme that you take on an empty stomach. And it's a great anti-inflammatory, by the way. And what it does, it's like a Pac-Man. It looks for scar tissue, adhesions in the body, and helps clean it up. It's just a great little thing. Safe, very effective. It's not a drug. You can do your homework on there. And again, I'm not recommending that you do this. I'm just suggesting the alternatives and possibilities for you. So I hope that this gives you a little better understanding about your trigger finger. And remember, this is called tenosynovitis. It's something you can do to beat this thing. A lot of times these surgeons like to inject corticosteroids inside of it. They want to go in there and cut it. They want to do, but remember, anytime you have surgery, you're looking at potential damage of a nerve. You're looking at potential bleeding. You're looking at potential scarring after the surgery. I've had, I throw this out because I love every one of you. You know, I had a couple surgeries on my knee. The last surgery I had, they did one thing and I developed scar tissue in my fat pad. So I had to go back in and clean out the fat pad. Every surgery has repercussions. It has potential side effects. So I just want you to understand that give faith to the body and the ability, the innate wisdom within each and every one of us to do its job first. And then hopefully you won't need anything more invasive than that. If you enjoyed this video, actually I did, but I can't subscribe to myself. Please subscribe because I would love you to see many of my videos, way over 1,000 videos here on my channel if you just tuned in, and great self-help videos, probably the leading cutting edge on posture. Many great cutting edge nutritional videos and educational videos as well. Check me out, motivational.com on Facebook. I would love for you to leave your reviews over there if you don't mind. And I try to do my best at getting back to many of you. But again, I am overwhelmed. I can only do my best. But please leave your questions below because I'm sure there will be many thousands of people who will be reviewing this and looking at it and potentially responding back to you as well. Anyways, I know it's been a long program, but these programs take time because no one taught you how to drive a car overnight. So I'm hoping that this education will go a long way with you and help prevent surgery and help your loved ones and friends. And by the way, share this on your social media because I think a lot of people can benefit from this as well. God bless everyone, and we'll be back with you on the next video. Bye-bye now.